Hi, this is Dr. Roy Kim. I'm in San Francisco and Los Angeles as a board certified plastic surgeon, and you're listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today we have Dr. Roy Kim. Doc, how are we doing today?
I'm great. How are you?
Doing good. Thanks for joining with us. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change during your fellowship?
Residency, it was general surgery. My fellowship was in plastics and hand surgery and micro. So over time, I, of course, wanted to finish, but then I started thinking about what exactly my career would be. I wanted to do hand as well as aesthetics, so that was my original start when I finished. So the nerdy medical stuff, I think, is more easily understandable to other doctors. I wanted to do some hand surgery, I wanted to do aesthetics, and I wanted to do general plastic surgery. As I really came very close to the graduation date, I wanted to try to open up my own practice or join someone who's more established. So what happened is that I joined someone who's very established, and he fired me after 3 months. So then I was totally on my own. So in plastic surgery, this is a pretty common thing where people have disputes or they're not happy with each other. So having said that, the disputes far in the past, and it actually helped jumpstart my career in solo practice. So I've been in solo practice for many years now.
So when you're going into that first job search process after the fellowship, what was the mindset you had? What did your outreach process look like? And ultimately, how did you land that job?
Yeah, it was through personal connections. So I didn't apply to that many places. And I made the mistake looking back. My mistake is that people cared about my credentials. To be quite honest, I don't think that many people care about your credentials. Most programs are quite good. Most fellowships are quite good. You're going to pass your boards because the vast majority of surgeons at that high level are going to pass the boards. So that's really not the issue. The issue is much more about personality, compatibility, what you want out of life, geographic location, lifestyle. Do you have family? Do you not have family? Do you have kids? Do you not have kids? Are you going to have kids? Those are much more important, actually, than your surgical training. That stuff is so important that you need to sort of do a self-assessment, maybe a year or 6 months before you finish up, and start really looking at what you want to do.
That's a great point. So now thinking back, what were some of the keys of your success in your early career that helped you become successful?
I think that some of the keys that are a little unique would probably be your ability to persist and your ability to do anything and everything. So classically, there are a couple A's, like be affable, be available, be accessible. Those what I was taught when I finished my training. And those are all true, but those are all sort of cliches. I think the biggest thing is you have to be willing to do anything. So in other words, it's not just doing anything in surgery. You want to sort of hone in actually and focus on what you like and what you do. Rather, you have to be able to do all of the paperwork, all of the patient intake. You have to answer questions. You have to do some of the stuff that maybe a nurse can do, a medical assistant can do, a secretary can do, because even in a large institutional setting, even if you're an employee of a large healthcare system, people are not going to know the way you like to do things. They don't know your instrument preference. They don't know how you talk to patients. And that takes a little time. Writing it down actually helps. I think the other thing too is that you have to be willing to do all the little things, or consider doing the little things to actually save money and be more involved in the process. So when I started my solo practice, I actually filled out all the boring forms to get hospital privileges and health insurance panel privileges. And I viewed it as annoying paperwork, but I did it. The thing is that I have definitely seen over time that there are companies or HR consultants or medical billers that do all that for you. It costs money. And so it doesn't take up that much time as a doctor. It's just boring. I just listen to some music or something while I do it. And you can do it much faster than anybody else can. You know your educational background, you know your references, you know all of that crap. And so you have to be willing, that's a small thing, but you have to be willing to do those things. The bigger picture would be you like to do procedures. You can come up with a spreadsheet because every patient is going to come up with the same stuff. Am I a candidate for the procedure? What are the risks and benefits? How's the procedure done? What's the recovery time? Of course, that's on the textbooks. But your flavor on it is all you. And you need to think about that stuff and simply answer it when you open up your own practice, or even if you join a large medical group.
Now, thinking about your career, were you private practice focused all the way, or did you ever consider going the academic route?
I never personally considered academic medicine. I didn't have a strong research background, and also I was not interested in it. So there is a difference because a lot of academic plastic surgeons definitely branch out and start doing more clinical stuff, and sometimes they just totally leave academic medicine and go into a pure clinical, or let's say 90% clinical job. So that's always one thing that I think people who are really gung-ho on research really need to think about, because getting grants, doing pure bench research or PhD level research over several years is grinding. It's really all about the money, all about the Benjamins, and it is tough. My friends who are in that field, they've been successful, but some have been successful but chose not to continue it after a couple years because they found out that even though they have a PhD in high level research, they just didn't enjoy it as much.
Now, what advice do you have for the graduating residents and fellows heading into the job search process for the first time?
I think the biggest thing is that they need to really get a business mind on, and they need to get a leverage or negotiating mind on. So anything that helps you even start a small business, incorporation, things that help you and save you, such as insurance, savings plan, savings cushion, having like a line of credit or equity just in case you need it, but don't touch it. Those are the things to help reduce risk. I think the other thing too is that you want to get an expert who knows about employment law, because some of the employment contracts are very restrictive. There are obviously unique things about being a doctor. Certain states, it's actually legal to restrict where you can practice. So if you don't like where you're working, you can't move like 1 mile down the road and open your own practice. You may actually be legally restricted on doing that. Sometimes they throw that language in, but it's illegal in your state. Those are some sort of maybe generalities, and I don't mean to sound too negative. There are a lot of positives in it as well. So if you are going to an area where you perceive that you're more in need, maybe you can use that leverage that helps you in your negotiation for your 401k, your retirement, moving costs. I could go on and on and on. All that stuff is wide open and negotiable. As a surgeon, as a doctor, a lot of what we do is a single track. We just do it that way. It's federal, national, the way it's done. I mean, our college education, our med school education, our residency applications, our fellowship applications, all that stuff, we don't have to think about it. It's just done a certain way. Well, that's completely not true to get a job.
Now, thinking about everything is being done virtually now, and that the annual conferences really aren't happening. Hopefully next year they will. But what advice do you have for those graduating residents and fellows that are trying to rub shoulders with folks like yourself and interact with people that they used to be able to do during conferences, and right now they don't have that ability to do so?
Yeah, I think the weirdest thing is that social media is so much more important than in the even recent past. So we've talked about this at the journal I work with, PRS Global Open. If you are going into clinical work, which most graduates are going to be doing, what you want is a strong social media presence ahead of time. You need to start honing that during your residency, and the minimum would be 6 or 12 months before you finish up all of your training. Because you want to show people that you're available, that you have a personality, that you know what you're doing. Some of the safer stuff, of course, the post would be simply like some hobbies, anatomy. I do know that some of the cases you do can't be shown because technically they're not your patients because you're still in training. However, whatever you could do that shows that you care and you're excellent at what you do and you have a passion and a motivation for it, that's all fair game. I mean, that's all wonderful stuff. The nerdy track, in other words, even if you're going into pure academics, you have a PhD, you still need a social media account, because the more unique hits and clicks you have on your latest article at the PhD basic science level, that will actually enhance and help your career. H-index and altmetrics, which are nerdy topics for how unique is your article, how unique is your research, how often is it being cited, how often and how soon after your article is published that a lot of clicks and audience come to it. That's actually vital today, even at a very high level of academia. So social media is key regardless pretty much of what you're doing. I think the final thing too is that if you decide to change jobs for good or bad reasons, you still need your own social media account. You're happy with your job, you just want to move close to your parents or to a different state. You know, you need that social media account not linked to your employer, to your university center, to the previous group, because you're you and you need to build a niche audience and have patients know about you before you move.
And can you also tell us a little bit about the plastic surgery societies that you're involved with?
Yeah, I'm heavily involved with the American Society of Plastic Surgeons, also the ASAPS, the American Society of Aesthetic Plastic Surgeons. I am on the social media committee for our society, ASPS, as well as the social media editor for PRS Global Open. So what we found is that, number one, open access journals are definitely increasing the popularity. And the second thing is social media is actually vital to just disseminating clinical research, networking, bonding with our colleagues all around the world, all around the US. It definitely helps with just happiness in life. It's always good to like be reading the latest stuff, learning the latest tweaks and hacks. It's easier to talk to someone who's in your position in a non-competing area. When I talk to someone who's like 2,000 miles away, we both know we're not competing for patients in any way, and yet we can still bond and talk. Finally, job opportunities come up. I've referred patients to people who are like very far away from California. Patients have been referred to me through my friends for patients who like are moving to California. So it's all networking at a very high level, or maybe broader level than what we're used to. But it doesn't just have to be local. It could be regional or national, and sometimes even international. I think the biggest question is really what you want in life. I wish I thought of this in the past. I don't have any regrets in life, because you can't change the past. But it would have been better for me and for any recent or about to graduate person to really think, what do you want in life? Do you want to retire early? Do you not? How many kids do you want to have? Do you want to have kids? Do you want to have a partner? Do you want to get married? Do you not? What's your family life going to look like if you already have a family? What are your goals in terms of getting out of medicine? What happens if you have an injury or disability? What happens, good things and bad things? Let's say that you're able to potentially retire earlier. Do you still want to go working? Do you have other interests in life? Some of this stuff just happens, some of the stuff in a good way, you start realizing, well, I really like this procedure. So I'm going to do research in it. I'm going to investigate it. I'm going to come up with like research and do new ways to do it. Sometimes it's negative, divorce, significant medical illness, what have you. So life is filled with obstacles. Life is filled with the unknown. And you're going to be doing medicine for potentially 30, 40 years. So you really have to think, do I want to do it for 30, 40 years? If I don't, what else is there to do? If you actually want to do it for 30, 40 years, that's fantastic. Do you want to do it in the city that you're in? There's so many things that you want to think about. And I think that if you have a plan and have goals and you work towards those goals, then you're going to be better off.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.